My name is Mel Rosenthal. I've known Dr. Baradaran for 25 plus years. His predecessor kept telling me that I needed to have implants or I was going to lose all my teeth, and which was frightening. I couldn't see taking dentures, putting them in a glass at night and putting them in my mouth in the morning. It sounded pretty disgusting to me. Dr. Baradaran was very nice, and he went along with the same dialogue, you should have it done. And finally, 25 years ago, I had the implants put in, and at that time it was not a tremendously popular surgery, and Dr. Baradaran did the surgery, and there was very little discomfort to it at the time, and it took several months. I think they did it in quarters, if I remember right. So I'd start with this quarter and then put posts in, and I'd do another quarter and then put posts in, and then the next thing I knew, I was busy eating delicious steaks and food that was uncomfortable for me to have. So I have been going to his office for all of these years, and I hope that I continue to go for a lot more, because I think he's absolutely the #1 periodontist in the city of Los Angeles.
Something that we did in Mel's case that was very novel at that time, 25 years ago, is unfortunately he had to lose all his teeth because of periodontal disease. And he was a young man then, he was in his early 60s. And the question was, what was he going to wear during the treatment phase? And he made something very clear in the onset. He said, I don't want to have a denture. And our goal was to give him teeth during the healing phase in such a way that he could smile and function and eat normally. And at that time, it was not very popular for us to immediately load implants. And what I explained to Mel, I said, we're going to take all your teeth out, we're going to put 23 implants, and we're going to over-engineer your case. And what we're going to do is that we're going to use some of those implants immediately and use them as temporary foundations to make you a bridge so that you can leave the office with teeth in your mouth. Luckily, all 23 implants took. And now today, when you go to academy meetings, that's what dentists are doing. Something that we did 25 years ago is something it's being done more now. And this allowed Mel not to have something in his mouth that's removable. So his temporary phase and his final outcome is completely cemented in his mouth. He has individual teeth. And I'm grateful that he comes every 6 weeks to see our outstanding hygienist, Diane. So I'm very proud of this case because it proves the test of time of how successful implants can be, and how, if it's planned well, how we can achieve the outcome that we were desiring from the onset.
And it has, it certainly has. And I'm very, very happy with it. And I'm happy with you all these years.
Thank you. You've been a pleasure.